everyone, I am Marilo Ganghe, a caregiver student from St. Augustine School of Nursing, Iloilo branch, and today I will going to demonstrate NGT Feeding. A nasogastric tube or NG tube is a special tube that carries food and medicine to the stomach through the nose. It can be used for all feedings or for giving a person extra calories. First thing you will do is ask the patient for his full name or watch the patient wrist, because there is indicated the full name of the patient so that you're doing the right procedure to the right person. Explain to the patient what procedure you will going to do. Good day, sir. I am Marilo Ganghe, your caregiver in charge. May I know your name, sir? Okay. Sir Leo. Thank you. So, today, sir, I will going to feed you using the NGT. So, first, wash your hands with soap and water. So, I already wash my hand with soap and water, and I already wear my gloves so that my patient will be protected from contamination, and also I am. And then prep the patient up to at least 30 degrees. Okay, sir, I will elevate you for at least 30 degrees, sir. So, after elevating the patient into 30 degrees, ask the patient to open his mouth and check the back of the throat. This is to make sure that the tube is not coiled. Sir, can you please open your mouth? Ensure that the recommended external length of the feeding tube is measured and consistent during the feeding. And then secured the feeding tube firmly to the nose and to the cheek with a tape. To check if the feeding tube is in the stomach, withdraw some gastric content using the syringe. If you are unable to withdraw some gastric content, lay the patient down to his left side and withdraw again the gastric content. If you are still unable to withdraw gastric content, wait for 15 to 30 minutes and try again. And then read the gastric content pH level. If the gastric content is below or equal to 5, the patient is ready to feed. Take note that pH level can be affected by certain medication. Check the feeding schedule and prepare the correct amount of oral nutrient supplement prescribed. Prevent air entry to the stomach by kicking the feeding tube before connecting the syringe. Flush the tube with 20 ml of water or as prescribed.
Put towel on the patient's chest to catch some liquid that spill during feeding. Flush the tube with 20 ml of water or as prescribed by the doctor. So feed according to the feeding schedule. Position the syringe slightly above the head and ensure the syringe is not empty during feeding. This is to minimize stomach discomfort due to excessive air entry. And then, after the water, put the oral nutrition supplement. So we have here the milk for the oral supplement of our patient. So as what I've said, ensure the syringe is not empty during feeding. And other one. Let's finish. So next, feeding medication. So ensure right medication is being prepared. Always check the doctor's order. Crush the medication finely or dissolve the pills in lukewarm water. Then connect the syringe without the plunger to the king feeding tube. And pour medication into the syringe. So, after administering the medication, remember to flush the feeding with 20 ml of water or as prescribed. And we're done feeding the medication of the patient. So close the NGT tube and the patient should remain seated for at least 1 hour to prevent gastric reflux.